All right, so today, ladies and gentlemen, we thought of visiting Agawar's Eye Hospital here in Rhodes Park in Lusaka. And it's been a while since we came here. I think the last time that we were here, I think it should be in December in 2018. But we thought this year, after 6 months down the line, we can actually come through and come and visit our lovely doctor here, as we tend to look at refractive error as well. Now, this is a very common problem that many Zambians actually have. In fact, when you look at me, I'm putting on glasses because perhaps I might actually be a victim of that. So how about we learn together in terms of what refractive error is and whether you actually are a victim of that, and what are some of the signs that you might actually be experiencing this particular problem as well. Welcome to your health talk, and of course my guest on the show today is Dr. Githa from Agawar's Eye Hospital here in Lusaka, Rhodes Park area. Dr. Githa, thank you so much. Good to see you again.
Good to see you, Nelson.
Thank you so much. I've been all right. How are you?
Good, good.
Oh, great,
Yeah.
great. Today we are back, and I wanted to look at refractive error. Exactly, and I'm sure that as we'll be discussing this, we'll also look at why Nelson is putting on glasses as well. First things first, what is refractive error?
Okay, the thing is, refractive error means there is a problem in getting the light refracted and coming to a clear focus so that you will see clearly. People who have refractive errors, meaning that certain distances they see well, certain distances they don't see well. So the problem in refraction is called refractive error.
Okay. How big is that problem?
It is really a big problem, because if it is not diagnosed at the right time, and if you are not wearing glasses to have a clear images and a clear view, the eyes may go lazy.
Okay.
So it is very important.
What are some of the symptoms of this condition?
Usually nowadays children are very brilliant. They themselves bring the patients. That is parents. That is a very quite interesting thing. Like they may have a blurry vision. Sometimes they will have an eye strain. Sitting in front of the computer or sitting with the gadgets will give you headache. Or they are going closer to the TV and watching TV, or watering, or sometimes headache.
This condition, does it depend on the age group, on the age of someone, or anyone can suffer from it?
Anyone can suffer, and definitely it will start from the childhood only, because for some time what happens is that if you have noticed that people, even small children are wearing glasses, right? That means right from the childhood this refractive error can happen. It doesn't mean only one particular age it will happen like this. Now when your linear growth, like height, you say height, will stop at the age of 19-20. That means your height becomes stable, right? Till then there is a possibility of you growing, right? Similarly, eyeball also will become stable in its development. Full development is there, but the size of the eyeball also varies from time to time up to the age of 18-19. After that it becomes stable. So now the refraction means what? The light entering into the eyes, okay, and getting focused, and then the clear image is seen. This is called refraction, correct? Supposing in any age group, if they have a refractive error, say short-sightedness, say long-sightedness, whatever it may be, then they won't be able to see clearly. So it can happen in any age group.
You've talked about long and short-sightedness. Maybe you can explain a bit more on the two. What's the difference, and how do they come about?
Okay, I have told you like that. The eyeball, if you take, it's like a globe. From anterior to the posterior surface, the light is going and falling into it. For example, the cornea, which is a transparent structure, it passes through the light passes through the cornea, and there is a pupil which is a shutter. It will allow the light to go in, okay, and then the lens that will focus, and then the focused image will be falling on the retinal center. This retina will process, there will be a photochemical changes. It will be converted into a nerve impulse and it is taken by the optic nerve to the brain. The brain will help you in interpretation. So you will be knowing this is a pen, this is a pencil, like that, right? So now there any refraction, the rays which is not focusing right in the center of the retina, they are getting defocused and it will give you a blurry vision. For example, for some people the short distance will fall in the right place, that is fovea, the center portion of the macula will absorb all the light, okay, the images are formed, and this retina will not get the focus of certain distances, like short distance it is getting the focus, for long distance or some intermediate distance it is not getting focused. Now the lens is at fault, sometimes the cornea is at fault also along with that. So in that condition you have to wear a glass which will help you in the extra focus you need. For example, you need -1 diopter. So we will give you -1 diopter. Suppose if you have an astigmatism, again okay, for example 0.5 into 180 degree axis if you need, then we will give you an short sightedness glasses plus astigmatic glasses. So you will have a myopia and astigmatism, then you have to wear the glasses all the time. Long sightedness means like long distance will be falling clearly to your focus, but short distance will not be so clear. Then you have to give a particular glasses in that. Yeah.
When you look at the two conditions that you've talked about, long distance, short-sightedness and long-sightedness, which one is more serious between the two?
And both are equally important to be corrected, and each one have got its own advantages, each one has got its own complications, like more number of patients will be short-sighted compared to long-sightedness, and supposing if they are not wearing glasses, slowly they may squint or slowly they may have a lazy eye, like.
So now we make an assumption. I'm long-sighted, and from a long distance I'm able to see clearly, but from a short distance I'm not able to see clearly, and I'm given glasses. Will those glasses be able to affect my long distance view, my sight, my normal sight, at least at long distance? Am I going to be affected?
Affected means?
Will I be able to see properly even from a very long distance if I'm putting on glasses?
See, there is an acuity standards. To certain distance you have to see clearly without glasses. Suppose if you are not seeing clearly, for that distance we will give you a focusing lens.
Okay.
So you will be able to see clearly.
Okay. I've seen a number of people who have time and again you'd find that they usually just start producing tears from their eyes, and when you ask them they would tell you, okay, my eyes usually tear out just like that. Could that also be a sign that that person could have refractive error?
Sometimes yes, sometimes yes. Sometimes you see, if they have an astigmatism, they will be having itching in both eyes, redness will be there, then watering will be there. So it may be a consequence also in few cases.
Do machines such as computers, phones, too much light also contribute to refractive error?
To a certain extent, yes. A small power, yes, not continuously. If they are watching TV or watching any gadgets, doesn't mean that that produces the power. Since you have a power and if you don't see well, you are identifying that you have a refractive error. But long standing, long hours of working in computers, long hours of watching TV, what will happen is the bright light is not good for eyes. Many children after 10 o'clock, 10 p.m. like that, they will be sitting in the gadgets, in the dark they will be using the mobile phones, and they will be using their other gadgets also, which is not good for eyes. because sometimes the constant looking into certain gadgets, you will not blink frequently. So infrequent blinking also will give you dryness. That is the biggest problem. So dryness will be there. Then the bright light, supposing if you are not sleeping in the right time and if you are with the bright light, then the retinal pigment formation also will be affected, and they will have headache, stress induced headache, all those things will come. These are all consequences.
What's the connection between wearing glasses and headaches? I've heard some people complain, oh, when I began wearing glasses, I started having a headache. What's the connection there?
Okay, for example, we have been talking about that eyeball size will be increasing, it will become stable at the age of 19 and 20. For example, up to certain age it is okay, certain age the muscles and the eye anteroposterior segment and focus, if there is any disturbance, then you will have to strain to see near or far. In that situation, the straining of the muscles which are attached to the lens inside as well as muscles around the eye also will give you headache.
Okay, interesting. All right, so to all our viewers, we are here at Agawar's Eye Clinic here in Lusaka, and we are discussing refractive error as well. And some of the issues that we're looking at have to do with why wear glasses, when are you supposed to wear glasses, and what happens if you are short-sightedness, or you are short-sighted, or you are long-sighted as well, and what can you do about that? Dr. Geetha is my special guest on the show today. Dr. Geetha, now, how do you correct refractive error?
Okay, it's quite interesting. Like at any age, if they have a problem, we have to do the thorough examination. We do comprehensive eye checkup. For every patient, we do the comprehensive eye checkup. Like that, we have to see the vision, we have to dilate the pupil, again we have to recheck whether there is any small refractive error, and then we check the retina. All parts of the eye we will be examining them, and finally we will conclude if they are having a problem that they need to wear glasses like that. For short-sightedness, we will give myopic glasses, short-sightedness glasses. For long-sightedness, we will give long-sightedness glasses. Okay, and we have got contact lens also for myopia. So children, first we will give only glasses. That is very important, the perfect glasses, and we will advise them to come every year for a normal checkup. We have to check their power every year because they are growing, right? And after that, after the age of 13, this myopic glasses can be replaced by contact lens, or sometimes you can have a contact lens in the day hours, and evening when they come home they can use the spectacles like that. Contact lens can be used from the age of 13 because the person will be able to handle it. That is the thing. Around the age of 19-20, if they don't want to wear the glasses, if they want to go for LASIK surgery, then that is an option. For LASIK surgery, there are certain parameters. The corneal thickness should be okay for them, for the power what they have. For example, -1 to -3, which is called mild myopia. More than -3 to -5, it will be called as moderate, and -7 to and above, it is called high myopia, and more than -10, it is a pathological myopia. So, if your eye cornea thickness is okay, then you can go for LASIK depending upon the power, okay, and if not, then you are suitable candidate for intracolumnar lens. You can go for a surgical treatment also. But all these things only after 20 years.
This condition, is it reversible? The refractive error, can it be reversed?
It is stable after the age of 19-20. It is not irreversible. Supposing if you have 0.25 and 0.5, which is a muscle component, okay, sometimes you may get reduced if you improve your eye muscle exercise, nutrition, all those things. That is a possibility, and not straining the eyes much, like sitting late night in the bright light. So that is also okay, not more than that.
Okay, interesting. All right. So now, when somebody has been given glasses to be wearing, are there times when you can wear your glasses and you cannot wear your glasses?
I mean, whether they can discontinue. That is what you mean, right?
What I mean is, you give me glasses today.
Yeah.
Is it that I need to have my glasses with me throughout the day, or maybe I can decide to take them off, move without my glasses?
This is a question every parent will ask when they bring their children for the first time, when we say that they have to wear glasses. Okay. See, for example, if you are sitting in this room, all things you are seeing well, but you are not seeing far away. Okay. You are sitting inside the room, but you are not able to see far away if the window is open, right? That means, is that okay? If your friends are walking over there, you will not say hi to them. You'll say, see, Nelson is not looking at me like that. Is it okay or not okay? It's not okay, right? So even if you are in the short distance where you see clearly, suddenly when you turn and look little far away, you won't be able to see well. It's not good. It is an eye strain. So when you have a power, it is better to use constantly.
Okay, interesting. One of the issues that also scare people from, maybe going for glasses, many people have been told that, the more you put on glasses, the more you are damaging your eyes. How true is that, though?
Now that myth has gone out of people, because at least my patients, we educate them. It is not like that. We are growing, so it is also increasing. That's all. When it becomes stable, then I think you will have a stable power. It is not that because you are wearing glasses, next year it is going to increase. Not like that.
Okay, interesting. For anybody who is wearing glasses, if you start putting on glasses, are there any other, do you also encourage eye drops or anything?
For refraction, there is no need for eye drops, but people who are working in computers and people who are reading a lot, sometimes people who are traveling, all those people will have dryness. For that, we will give some lubricant eye drops. Sometimes if they are having associated allergic conjunctivitis, then they will keep on itching, the epithelium will be disturbed. For those cases, we give anti-allergens and lubricants. Yes.
When do you recommend for surgery?
Okay, after the age of 20, if the power is for myopia more than -10, they will be wearing thick glasses. The disadvantage of wearing a thick glass power is the frame itself will mask your field of vision. You have to turn your face to look at right, look at extreme left, like that, right? Right and left when you are looking into it. So you have to turn your head and you will be having a minimized image. So these are all difficulties. So you can remove that situations once the eye power becomes stable. Even last week I have done one intracolumnar lens implantation for a patient, and the power was -8 and -2.5 cylinder, and that patient is reading all the 6 lines now.
Okay.
And she was having only close to face movement to 6.6. Her visual acuity improved a lot and she doesn't need glasses. Always any procedure you do, there will be a small dependency on glasses, but you may not need to wear glasses, but 0.25, 0.5 may be a residual power.
So do you usually recommend that, regardless of the problem that somebody has, they should go for surgery, even without trying glasses first?
No, not at all. Absolutely not like that. It is only indicated you have to do, not for everyone.
Okay.
No, those who which are better for them, that we will give glasses. If it is better, we can give them contact lens. If it is necessary, we will give the surgery, and if it is necessary, we will advise laser.
If someone is the first time of wearing glasses, what are some of the recommendations that you usually allow them in terms of, or you tell them in terms of how they can get used to life of glasses.
Yes, exactly. Children, they will get accustomed to the glasses very fast. But people around the age of 40, another condition called near vision problem. The lens become dysfunctional. The converging distance will exceed. You will be pushing your papers to far away to see clearly. This condition is called near vision problem. So in this condition, you have to wear a near vision glasses in a progressive form. See, for example, from distance, intermediate and near, when you have a progression, you will be able to read the things which is in your laptop, which is in your working distance. You can read, you can see distance also. So I am wearing a progressive glasses, so I can look far, I can do my intermediate distance coverage, and if I have to read, I will be able to read. This is called progressive. So the progressive glasses, it takes some time for people to get adjusted. Suppose if you have a power, in addition to that you have to add, once in 2 years you must change your glasses, because the power increases as your age increases for the reading, right? So you need to get accustomed to the progressive glasses. That people will take some time, especially gents will take some time. Ladies will get used to it. Yeah.
For someone who is short-sighted or long-sighted, how often are they supposed to be coming for eye checkup after glasses?
Okay. Supposing if the child starts the glasses around the age of 5, every year it is very important. If they start only around the age of 16, 17, once in 2 years it's fine. After the age of 40, once in 2 years is important. After the age of 50, definitely once in a year they have to come, because after the age of 50 you have lot of other problems in the eyes like glaucoma, cataract, retinal problem, all those things will be there. So after the age of 50, every year is better. 20 to 40, okay, once in 2 years it's fine. Or 40 to 50 also, once in 2 years it's fine. But after the age of 50, once in a year is better.
Can refractive error also attract problems such as glaucoma and of course other eyesight conditions?
This is a focusing problem. It is not a disease. It is not a like a communicable disease or something like that. It's not so. So it is a condition.
Okay.
Yeah. Okay. It is a refractive error is a small disorder in lens functional aspect. It is not associated with much of the other diseases. Okay. In other diseases, sometimes it may be there. People may have this, but it won't produce any other disease. That's it.
Quite an interesting topic, really, ladies and gentlemen. Dr. Geetha has explained quite a lot in terms of why it's important that you put on your glasses and why it's important that when glasses are prescribed and you're told to be wearing your glasses, you need to make sure that all the time you have your glasses with you. It's very, very important. Okay, so now after the break, Dr. Geetha will demonstrate how refractive error comes about so that you can definitely get to know using a visual aid how this particular condition comes about. But you also need to know the difference, and you also need to know that there is a difference between having glaucoma and of course other diseases that are associated with the eyes and this particular condition called refractive error, as well as Dr. Geetha just explained just a few minutes ago. So for now we take a very short break. When we come back, she will definitely be on the board. She will be explaining to us now refractive error using an image of an eye.
Nelson, you wanted to know about how the refractive error happens. Like, see, this is a picture of the eye. Okay, these are all the parts of the eye. I will explain to you. See, this is the cornea, which is a transparent structure. This will allow light inside. Okay, this is the pupil. This pupil has a diameter of 2.8 millimeters to 3 millimeters, and when the light enters this will allow the entry of the light. Okay, then now it will fall on the lens. This lens will contract and relax because it is attached to the zonules and these muscles. Okay, ciliary muscles. So this will contract and relax, that light will be getting focused in the retina. The retina is like the film of the camera. So this will capture the image and form the clear image and send it through the optic nerve as a nerve impulse. So the photochemical changes which will make the nerve impulse will be taken by the optic nerve to the brain will interpret, right. Now the cornea should be clear, the lens should also be clear and focusing. This is a vitreous cavity, and the vitreous is a gel, and that also will participate in sending the light here. Okay. Supposing if you say the light getting focused in the right place, it will give you a clear image. Suppose if it stops here, certain distance will be focused, certain distance is not focused. Now you have to put a glass here so that this focus will be taken to that. This is what will happen if the eyeball is slightly larger. In children you have seen that anteroposterior diameter will be slightly larger. In that condition, short-sightedness, that is myopia, is most commonest, and they will not get a clear vision for the distance. So this distance focus will fall before the retina. To take the focus to the retina, you need to give myopic glasses. Vice versa is the long-sightedness. The anteroposterior diameter will be slightly shorter than the myopic eye. So the certain rays will fall here, distance rays will fall here, and short distance might be falling little back. So then you have to give another glass, long-sightedness, hyperopic glasses, to bring that focus here. That is how you make the patient see. So whether myopia or hyperopia, you need to wear glasses. Another part is the corneal curvature. That also, if sometimes flat in both vertical and horizontal axis, it is fine. If one axis, if it is steep, then there will be two focus, which is not a clearer focus. Now you have to give a correction, astigmatic correction, along with the myopia or hyperopia, to take the focus in the right place. This is how the glasses work, taking the focus to the right place. Thank you.